Thank you for making the decision to watch this video on doing the impossible. That is improving your knee pain when no one else has been able to help you so far. In this short video, I'll go over in detail precisely what we've done for others and how we've helped them. I'm going to tell you the secret to how a 68-year-old discouraged ex-office worker with a cholesterol level of 284 who could barely walk due to pain lost 42 pounds and was able to dust off his golf clubs and renew his passion. So drop whatever you're doing and pay close attention, because what's contained in this video may very well change your life. My name is Dr. Robert Wallace. I'm a chiropractic physician. I'm a board-certified integrative medicine doctor as well as a certified functional medicine practitioner. Now, these things make me uniquely qualified to correct many difficult to treat conditions, including chronic knee pain. So what makes this idea work, and how is my program so revolutionary? Well, I'm going to tell you exactly that in just a little bit, but what I want to tell you first is what happened in my life to cause me to make this video and to have such an interest in knee pain. Now, my dad, who is 87 years old, he suffered with knee pain his whole life. He didn't do anything about it, and he let it continue to degenerate, and eventually his one-legged knee pain became both knees, and his mild knee pain became severe knee pain. It got so bad that he began pain medication, some severe pain medication that we now know has some severe side effects. And it got so bad that eventually he was told that complete knee replacement was his only option. That's what he was told. He was also told it was safe and effective and that there was very little risk. Well, my dad was one of those lucky 1 to 2% of people who gets post-operative infection. So he was in the hospital and rehabs for almost a year. It was torture for him, and it was a struggle for myself and the rest of my family. And apparently, this is much more common than you might think. So here's what the Journal of Bone and Joint Surgery has to say on the topic back in 2012. Periprosthetic joint infection continues to frustrate the medical community. Although the demand for total joint arthroplasty is increasing, the burden of such infections is increasing even more rapidly. And they pose a unique challenge because their accurate diagnosis and eradication can prove elusive. So, in other words, it's hard to know if you have it, and once you do know that you have it, it's even harder to get rid of it. And that's the reason why I'm making this video. Hopefully we can prevent you from going through any of that. So it is safe to say that whatever you're doing right now isn't working. Otherwise you'd be, outside or doing something more fun than watching me talk. But I want you to know it's probably not your fault. You're probably doing exactly what every other person who has knee pain does, and that is using either old school therapy, old school treatments until it gets bad enough until you need surgery, or you may have gone through all those treatments and now just waiting in pain on medication until you're bad enough to get surgery. So this video is on new and innovative treatments that I'll bet you've never had, and I'll bet you've actually never even heard of these treatments. So I realize that you're probably skeptical, and I want to let you know that it is okay to be skeptical. Watch the rest of this video with a healthy bit of skepticism, and you'll see at the end how I'm going to prove to you that I can help you. So here's the 4 problems we have to overcome. Number 1 is scar tissue. Number 2 is the large diameter afferents, which is just fancy wording for the nerves. The third thing we have to fix and address is structure and surrounding musculature. Fourth thing is cartilage and tissue regrowth. Now, if we can successfully address these 4 aspects, then we're going to have a good outcome. I'm going to go over each one of the 4 problems in detail, and then afterwards I'm going to tell you how we address them specifically. So number 1 is scar tissue. So prior to a tissue being damaged, I want you to think of healthy tissue as organized, strong, flexible, almost like think about a nice, beautiful wall that has new sheetrock and has freshly been painted, and it just looks beautiful with no imperfections. Well, when a tissue is damaged, it is replaced by scar tissue. So imagine the wall here is damaged and someone has put a hole in it, and now a person comes in and spackles it and then repaints over it. Well, if you investigate the wall closely enough, you'll learn and be able to see that the spackle job, although it might be great, is not as good as it once was in the past. So think about that as scar tissue. The other way I want you to think about scar tissue is when you have a massage. Someone rubs the back of your shoulders, you know, and they feel those lumps and those bumps. You can kind of hear grinding. It's kind of like beef jerky rather than a nice filet mignon. So when the tissue is damaged, it is replaced with tissue that is not as strong, it's not flexible, it's rigid, when we have that in the joint, it leads to a decrease in range of motion over time, and it also will equate to pain as well. So the second thing we're going to look into and we have to address is the nerves, those large diameter afferents. Now these nerves are the things that allow you to feel the ground. So when you're walking barefoot and you step on a sunflower seed, you can walk by and say, wow, I think I stepped on a sunflower seed. Or if you step on a dime versus a quarter, I think I stepped on a dime, you're getting sensation from the ground and you're able to get that signal up to your brain and process it. So feeling the ground is an important thing, and that's what the nerves are intended to do. The second thing that those large diameter afferents are supposed to do is they feed into the spinal cord, into an area called lamina 2. And that area, that nerve is intended to inhibit pain. So it's kind of like, imagine your stereo and having a volume switch. Well, when those nerves are working properly, it's like turning down those pain fibers. It inhibits the pain fibers. So when we damage those nerves over time through elevated blood sugar or through inflammation or from autoimmune diseases or heavy metals or some other cause that eats away at those nerves, then eventually it just feels like we're turning up that volume all the time. So we definitely need to address those, A, so you can feel the ground and you're not a fall risk, and B, so that we can manage your pain. The third thing we have to address is the structure and the surrounding musculature. So your knee has an ideal way that it was built and it was intended to function. Any misalignment or abnormality will lead to more wear and tear, will lead to decay, and then will lead to scar tissue. So I want you to think of that like car tires. So if you have a car that's properly aligned, you can drive on those tires for 50,000 miles before you need a new set. Well, if your tires are wearing out at 15,000 miles, it would be wise to go and take a look at the alignment. What might be causing that to happen, rather than waiting for that 15,000 miles to go up and get a new set of tires and then another 15,000 miles and a new set of tires. You need to address that structure and you need to address the alignment. Same thing occurs in the body, whether it's the spine, the hip, the knee, it doesn't make a difference. And the surrounding musculatures that associate with it, those are really important to address. Now, physical therapy does tend to do a really good job at that, but it does ignore the other three aspects of our program. So number 4 is cartilage regeneration. So once we have the scar tissue taken care of, once we have the structure and the alignment improved and the nerves are healing, now we need the tissue to regrow, and we need cartilage to regrow. Now, my program addresses all 4 of these problems, and which is why we get such good results, even with people who have severe bone-on-bone knee pain. So at this point, you're probably asking yourself, okay, great, you say you fix all these 4 things, but how? How do you fix these 4 things? Well, I'm going to go over that in just a minute. I'm going to tell you exactly what we use, the techniques we use for that, the specific new technology that we use. I'm going to be able to talk about each one of those. Now, in our clinic, we may use any one or combination of these technologies that I'm about to speak about. So the first thing we might use in your case is something called knee decompression, non-surgical knee decompression. So over time and with injury, the pressure that is put upon that knee will force that synovial fluid that bathes the joint, forces it out and away from the center. And it leaves those surfaces to wear out with insufficient lubrication. And non-surgical knee decompression is going to relieve pressure on that cartilage. It's going to help lubricate the cartilage. And here's how it works. You will be sitting on a table with your knee outstretched and up on a pillow. your foot will be attached to our decompression device, and it will be pulled. Gently pulled apart and put back together. And that's going to help lubricate that joint. It's going to create space in the joint. It's going to relieve pressure on the joint. It's going to increase the circulation of that synovial fluid in the joint. It's going to stimulate new cartilage growth, and it's like oiling the Tin Man from The Wizard of Oz. Each one of those joints. The next therapy we may use in your case is called HACOMed horizontal therapy. Now, this is the most sophisticated form of electrotherapy that's available. No other machine can do what the HACOMed can do. It's going to stimulate two different components of the cell. One is the bioelectrical component, and at the same time, it's also going to be stimulating the biochemical component. That's how your cells function, that's how they communicate, and it's going to do both at the same time. Nothing else can do that. Now, there are dozens of clinical trials that have been done on the horizontal therapy machine, the HACOMed machine, and there's nothing else out there like it. The machine itself is expensive. It's $25,000. It's very different than that ordinary electric stim that you may have received at your physical therapist or your chiropractor. It's non-invasive, and it's very pleasant to the body. In fact, you might not feel anything when that's on you. This is the machine that's going to help you rebuild those nerves. It's going to help the nerves heal so you can feel the ground, so you can turn down that pain level and strengthen those large diameter afferents. Next thing we might use is low-level laser therapy. There's been a lot of research and technological advancements in the field of lasers in the past 10 years. They're incredible, they're remarkable devices, they're expensive devices, but they work. They increase circulation, they increase tissue oxygenation, they're going to increase the cell's energy production, all of which are going to help make you feel good again and allow you to be able to do things you weren't able to do before. Now, there was a recent study done with lasers showing that it's going to help increase collagen growth and stimulate better organization on the wound healing. So if you think about that spackle example we gave you before, it's going to bring in a better spackler, someone who's not going to just do a hack job. The laser is going to help organize those tissues to be more like the original tissue in the first place. So you'll feel less pain, you'll heal better, and again, you'll be able to do more. Next thing we may use in your case is the arthrostim. We talked about alignment before. How are we going to work on the alignment? Well, we're going to work on the muscles. Okay? We're also going to work on the brain, the postural centers of the brain. So the arthrostim works on the principle of neurological feedback. So joint stiffness, pain, and muscle spasm will result in an altered sensory input from all the sensitive nerve receptors in the joints, and in the ligaments, and the muscles, and the tendons, in the skin. All those these nerve receptors are getting information from the environment, and they send a message up to your brain to be able to process that. The arthrostim is going to deliver some mechanical sensory stimulation to those receptors, which are going to communicate up with the brain. And we can stimulate the joint without stimulating pain receptors, so the treatment is comfortable. This powerful sensory input that I talked about is going to reset the postural programs in the brain. It's going to restore normal motion, normal function, and position of the spine or the extremity joint or the hips or whatever it is we're dealing with. In this case, the knee, but it's not just the knee. It's ankle, it's hip, and it's back. If those things aren't working, then the alignment of your car is off and your tires are going to wear out at 15,000 miles. Another therapy we may use is a device called the rapid release device. Now, this machine is awesome. It is a machine that helps break up scar tissue. Now, rapid release therapy will rely on the science of resonance. So you may have seen an example of an opera singer who belts out this really high note, and the resonance breaks the glass on the other side of the room. Well, that's how this whole thing works. We talked about the scar tissue being rigid before, and this device oscillates at such a high rate, it's applied to the knee, and the scar tissue will not vibrate or resonate. It's going to be broken up. Normal tissue will, so it's going to painlessly and quickly remove that scar tissue. So after that, we're going to do, actually not after that, we will be also doing infrared heat. Infrared heat typically is done at the beginning of treatment. That's something that in and of itself has been shown to help with knee pain, even if we didn't do anything else. It's going to decrease pain, decrease inflammation, it's going to relax your muscles, it's going to get you ready for treatment, and it's one of the first things that we're going to do. So now that we have the scar tissue addressed, we have the nerves addressed, we have the structure and the muscles addressed, and we've put the joint in a position to regenerate, now we need the raw materials. We need the nutrients that are going to encourage cartilage growth and discourage excess inflammation. We have that covered in this program as well. So we need all these things addressed at one time. It's not just one magic treatment or one specific treatment. It has to be a synergistic effect. And with that said, I do have to address what I call limitations of matter, or what you could term the elephants in the room. Well, what if you are 50 pounds overweight? What if you're diabetic and your blood sugar is out of control? What if you have rheumatoid arthritis and you're eating provocative foods that are causing your body to attack itself? What if you're on an acid reflux reducing medication and you're not able to absorb the good foods you're eating and the supplements that you're putting in your body? We have to address these things, folks, too. They're part of the program, and they need to be part of the program. Now, if we do all these therapies and we help you lose 25 or 50 or 100 pounds, think of how amazing that will be. Think of how great you'll feel, how healthy you'll be, and you might never actually need surgery once you do those things. If we get your blood sugar under control with my unique methods, you'll finally heal, because it's very difficult to heal if you don't get it under control. We've heard of diabetic wounds that don't heal. Well, we need to get these things under control. If you're anemic, you're not going to get oxygen to the tissues to heal. So we've got to address that too. Is it iron anemia? Is it B vitamin anemia? Do you have a genetic defect that is causing you not to be able to absorb these things, so you need a special B vitamin? We have to look at those things. All of those things matter, and they're part of the program too. And those are things that are almost always ignored in all other programs. So if you're not willing to change your diet or take some specific supplements to decrease your inflammation and promote regeneration of healthy cells, then don't come in. Seriously, if you're not willing to take drastic action, then don't waste my time. You know, if you're serious about getting better, you'll do what is necessary and we'll get a great result. You know you have a knee problem. Conventional wisdom says wait until it gets bad enough that you need surgery. Does that sound like a good idea to you? Doesn't sound like a good idea to me. Now, what if you're considering arthroscopic surgery? Research it. Look into it. The New England Journal of Medicine itself says it provides no additional benefit to PT or other medical therapy. So maybe you should reconsider arthroscopic surgery. How about total knee replacement? Well, that may be something that you have to have, but don't rush into it. Consider infection risk. Consider particle disease, and Google it. Google particle disease. Consider alternatives like My Program First or other ones. Just do something, whatever you can, to avoid that surgery if you can. How about some frequently asked questions? Number one question people ask me, do we accept insurance? Well, yes, we do accept insurance. Bring in your insurance card with you on your first visit. We will verify that. We'll find out exactly what it covers, what it doesn't cover in regard to your program and what your program will entail. Everyone's program is going to be slightly different, so we'd have to look at you first before we know that, but we do accept insurance. Second question is the program safe? Well, the program is very safe. It's non-invasive, and it doesn't hurt. Most of what you're going to be having in here feels like nothing is happening at all, frankly. When we do the rapid release scar tissue removal, there are some points that might be a little bit tender, but we can manage that and we can alter the pressure that we put on there. So yes, it's safe. Other frequently asked questions are, have we helped people with bone-on-bone knee pain? Yes, we have. We've had lots of patients with bone-on-bone problems, and they've achieved great results as well. We've even had patients who've had complete knee replacement and haven't gotten any better with a complete knee replacement, so they've come in here, we've helped them. Do we treat shoulders, hips, spine, etc.? Yes, we do. How do I make an appointment? Well, that's something that's pretty easy. You call our office, 609-662-4714, and talk to the receptionist. She'll be able to set you up with an appointment with no problem. So I hope this video was helpful. I hope it gives you some insight as to what we do and why our program is different than anyone out there, and also gives you some hope that it might not be the end, that you may have hope to be able to get better and to completely feel like a new person. So do all that you can. Research all the things we've talked about. If you feel comfortable and you'd like to make an appointment, give us a call. I'd love to evaluate you and see how we can help.
Okay, my name is Vincent. I had problems with my knee for quite a while. I was really
think more than 5 years?
I would say about 4 years ago, I had an accident at work, and then it was very hard for me to walk. I was in a lot of pain, and then I heard about your program. As a matter of fact, I was treated before by other doctors. I got injections, I got medication, nothing helped. So I saw you in the internet, so I came here, I started with your program, and all I can say that it does help me a lot. And sometimes, like I was at work, I was sitting down. When I got up, I was aching a lot. It wasn't a day that I didn't walk. That I walked, that it was aching, was hurting. Now, since I'm here with you, I see improvement on a daily basis. As a matter of fact, yesterday I was at work, and I had the temptation to start jogging, okay, because this is how good I feel about it. So I said I should try, but I was a little afraid. I said maybe I should wait a little bit. But I feel like I want to now run, and all that I owe it to you. Your treatment is beautiful. I really would recommend it to anybody. As a matter of fact, if there is anybody that I know that has a knee problem, I will send it to you. And I already did. I see people, oh, I got this problem, and I said, I got a good doctor for you. So all of that, I appreciate it, and I really owe it to you.
Yes, this has been, I've had both knees scoped years ago. I've had braces, I've had, all different types of things, and nothing really seemed to work.
To healing and improving the knee. And as you said, we've only treated the left knee, we haven't treated the right knee. And today you told me, is it possible that we treat the other leg as well? Which of course it is, but you do notice the difference between the two. And sometimes it's good to experience that benefit on one side versus the other, because it's almost a trial of your own. You get a chance to really compare things, something that's being treated to something that isn't being treated.
Right, it's like I'm a scientist, and it's like a scientific experiment where you keep, you do something to one thing, and you notice the change, and it's definitely helping the treated knee. I'm sure just after 3 treatments, it's helped. So,
do some more to do even better.
Do more. I feel it'll really help. Yeah.
All right, great. Now, you also have an Achilles issue, which
Yeah.
you share with me. I have the same type of thing. I had Achilles rupture, and you had Achilles rupture as well. So we're doing some work on that. And right now I want to share the what the rapid release device is with people. And I know you've noticed a difference with this too. This machine is pretty awesome, as you can kind of see. If you don't mind, actually, I'll let you hold it just so I can see what our camera looks like here. All right, yeah, so this is the device itself. It doesn't look like much, but it is a powerhouse. It's super loud, but it works on the theory of resonance, and will break up the scar tissue that we have in there. So this is pretty amazing technology. I love it. We use it on the knee. We use it on really any painful part of the body that has any scar tissue on it. So
Yeah, my Achilles really felt stiff before these treatments, and now it feels a lot looser. I can, do my circles a lot better, and there's absolutely no pain.
Awesome.
In the area. Yeah, I would recommend it. It seems to be helping. From the initial 3 treatments, it definitely feels better. I think I definitely have more range of motion in the Achilles, and the knee feels really good. I just, I would recommend it.
I found your ad in the paper, and I was amazed to find out that something like this was in my backyard. I'm into it. I like it. I like the results. I like how I feel. I've lost about 18 pounds now, and I feel better all over. I don't know what I would have done without you. You have done so much to make me feel better, and I'm really grateful. If anybody out there has problems with neuropathy or weight problems, or you need a chiropractor and you don't even know it, make your way here because this guy is the best.
I feel better. I actually feel a lot better. I'm more energetic, and I have lost some weight, like 15 pounds, which is awesome. And I just, in general, just feel better, like just normal.
Okay, good.
I mean, it was hard at first,
Mm-hmm.
but you know what? It pays off, and I hope to continue, you know, because I just don't want to get back to that bad place again.
Right.
My flexibility in my knee was an issue. My shoulder was an issue. I also had the nerve issue when my body gets warm. That would affect my arms and my legs and across my back from shoulder to shoulder, which is really the main reason why I came here, along with hypothyroidism. That was the discovery of Dr. Wallace. But under that umbrella, I found all these other things that he was able to address.
How do you feel now?
I feel great.
You feel great. That's great.
I'm going to miss him. I'm going to miss you.
Because
I will do that. I don't want to start.
okay.
It's been wonderful being under him.
Mhm.
Different, I'll say, to the point I could not explain what I've experienced. This is something that you would just have to experience yourself. To date, I am the nerve issue I don't have anymore.
That's great.
And that was the main thing for me. I am one who don't really have, I don't experience symptoms to issues. So other than the bloating, and I knew that, you know, in me doing yoga, that my knee would bother me in the bending or whatever. I don't feel bloated anymore. The nerve issue is gone, something that I've been experiencing for years. And I feel good. I would give it between 5 and 6, where now I feel I'm like close to 10, very close to 10. Yeah.
So would you recommend this treatment to
Anyone.
how do you feel about Dr. Wallace?
I love him. I absolutely
Everybody loves
love him.
He's great.
He is. I feel his passion in what he does.
Absolutely.
Yes, it is different, but he has taken the time to learn this wellness, this overall wellness, and we need more doctors like Dr. Wallace versus my issue was I took this nerve issue to the PCP, who she could not even give me a name for what I had, but yet she could give me a prescription to treat it.
Right, and that scared you.
It scared me to death. Not only that, it slurred my thoughts and my speech.
Right.
And of course I took it because I didn't want to feel that sensation.
Right.
I come to Dr. Wallace one day, and he named it in one day. And he did not give me a prescription.
Right.
He gave me a solution,
Right.
which means so much. Get to the root of the problem versus treating a symptom.
Right.
And that was where I connected, because he understood where I was coming from. And just in being under him, I feel like he's on top of everything concerning the body.
Yeah, he knows what
Love you, Dr. Wallace.
he's doing. Okay. Thank you.
I believe that this is a very good therapy and has been very beneficial to me.
Well, thanks again, Maria, for sharing your your story with us.
Thank you for your help. You have been tremendous.
Good. Thanks again.
Nice experience. Perfect.